Well, hi, everyone. I'm John Schmidt, Senior Vice President of the Value-Based Care Exhibit Hall, and I want to welcome you to this week's Flash interview. And today our guest is Alicia Voorhees, and Alicia is Director of the Stellar Health Market Development Team. She leads Stellar's provider networking strategy across all their markets, and a very impressive position. So welcome, Alicia.
Thank you so much, John. It's good to be here.
Good. Well, first, I want to mention that Stellar Health has a unique web-based platform that helps primary care providers close patient care gaps. Very, very important purpose in population health management. So in that regard, now I'm going to ask Alicia a couple of questions about Stellar Health that I think will be of interest to everybody. Let me start with this one. What exactly does Stellar Health bring to the value-based care provider organizations that can help them?
Yeah, great question, John. So first and foremost, I think that Stellar Health brings some transparency and simplification of understanding what they need to do and how they can perform within a value-based contract. So whether you're a sophisticated health system or an individual primary care practice, it can be pretty challenging to navigate the complexities and different varieties of value-based contracts that are out there. All of them look a little bit different. And when you're working with 18 different payers, that can get pretty challenging. So what Stellar offers is a provider-centric solution that's payer agnostic, meaning our providers can come to one platform, see all of their payers in one space, and it's presented to them in a way that makes sense to a practitioner and not necessarily the way a health plan would think about it. So we're able to take data from the health plan, turn it into a simple checklist of actions that need to be completed for every single patient based on their unique care profile. So now if you're a primary care practice, you're going in and looking at your open gaps that are available for each of your patients that need to be completed for the day. And you're focusing on that, less so than focusing on, do I have enough patients in this program to work, to be participating in it, and trying to take the guesswork out of how they would perform in a value-based care contract.
Well, that is very helpful, I assure you. So I've been there, I understand.
Yes.
Well, let me ask you the second question then. What sets Stellar Health apart from its competitors? Because some other organizations might say they do the same thing.
Yeah, definitely. And there are a lot of organizations that can take, data from health plans and turn them into really interesting analytics and insights. What we're able to do is actually unlock that data into something that's actionable at the practice level and pair it with timely payments that are actually coming on a monthly basis to that practice. So one of the biggest challenges that we see with value-based care is that we're asking providers and practices to pay attention to these value-based actions that typically don't have reimbursement for 12 to 18 months after the fact. So by the time that check is coming back to that practice, very often it's, I don't even know what this was for. So what we're able to do with monthly payments is actually tie reimbursement to the work that's being done, which helps to incentivize why a practice would want to pay attention to the work that needs to be done, and the importance of following up there from both a patient outcomes perspective as well as how they would perform in their contracts. And the other thing that I think sets us apart is that of those monthly incentive dollars that we're pushing down to the practices for that work that's completed, we encourage the practice to share with the staff. So completing these actions is really kind of a team sport, and it involves the clinician, it involves the medical assistant, a care coordinator, the front desk staff, really everybody that's there is playing a part in closing all of these gaps. And by sharing some of those dollars with other members of the staff, we have seen tremendous performance from practices that are doing this, but also it really goes a long way of recognizing the work that the staff is doing to help complete these actions, and it's important to them. And I think in today's world of burnout and mass resignations from healthcare, this can really go a long way, not only just from a straight recognition perspective, from a financial perspective, but also really contribute to job satisfaction and retention.
Yeah. Well, thanks, Alicia. That makes a lot of sense. And it is much needed in the population health management world. I know.
Very much so.
Yes, certainly. So for more information, everybody, please visit the Stellar Health booth in the Value-Based Care Exhibit Hall. Lots of useful resource information is there. And thanks, everyone, for joining us. And a special thanks to you, Alicia, for all that you've been able to contribute this morning. So please stay safe and well, everyone, and visit that Stellar Health booth.
Thanks, John.